All right, it's 1 o'clock, so I'm going to call the meeting to order. Roll call, Susan Bartley, LaRon Coleman, Colleen Crossy,
Yes.
Ann Erickson Galt, Benjamin Greenwald, Tanisha Moore, Michael Spitz,
Here.
Pamela Turan,
Present.
Yvette Woodruff,
Present.
Dennis Yeager.
Here.
Could I get a motion to approve the agenda for today's meeting?
Me, Colleen.
Could I get a second? All those in favor?
Hi.
Do we have any public comment? Anyone here from the public or online? All right, we'll move to our provider presentation. It's by the Alliance, and Megan is going to introduce them.
Yes, I'd like to welcome up Mary Ann from our provider, the Alliance. They have come and presented to us last year. The Alliance does many different programs for us. Last year they came and talked about the Save a Life Station boxes that they oversee. And today Mary Ann is going to be talking about our prevention coalitions that sit under them as the umbrella and talk about what that system looks like. So welcome, Mary Ann.
Button here? Okay. All right. Thank you. Thank you for the opportunity to speak to you this afternoon. I'm Mary Ann Vergeth. I am the Prevention Director for the Alliance of Coalitions for Healthy Communities. I've been with the organization pretty much since the beginning. I was on the founding board, so I've seen us go through a lot of changes over the years. We've been around for over 20 years. So I guess next slide. So I just want to, I'm going to give you an overview of our prevention services, including primarily about our coalition network and how we work with our coalition network. Oh, that looks funny on there. So we are the umbrella organization for 21 community coalitions that blanket Oakland County with services. The coalition network is sort of the foundation of where the Alliance started. We started out with 13 coalitions back in the early 2000s, and you know, our primary work was providing prevention services and being the umbrella organization for these 13 coalitions. We've now grown to 21 coalitions across the county, and with the generous support of OCHN, we're able to provide funding to the coalitions to be able to operate autonomously from the Alliance, but with a work plan that we provide to them that is based on the priority problems that OCHN provides to us. So in exchange for that, we provide them $38,000, which allows them to hire like a community organizer or a director that works with their board. They all have their own independent board, their own independent 501c3s. And so they have their own community organizer that works with their board to implement these prevention services within their own communities. We provide them with the work plan and the outline. They're able to implement that work plan in the way that serves their community best, because you know, we have a varying, you know, different communities throughout Oakland County. Some are a little more affluent, some have some more socioeconomic issues, so they're able to take that work plan and implement it in the way that best suits their community. Next slide. So this is just a slide that shows where our coalitions are. We serve pretty much every school district in Oakland County. The only area that we don't currently have a coalition is the Farmington Hills area. We have some things in the works trying to get a coalition started there. So these are some of the resources, just some examples of some of the resources that we provide to the coalitions, because we like them to be able to have the funding that we're able to provide to them to pay their community organizer or to purchase things that they need locally. So we're able to provide them with a lot of printed resources so they don't have to tie up their funds in getting resources printed. So our primary substances that we focus on are underage drinking, marijuana, vaping, prescription drug prevention, tobacco prevention. So we provide these fact cards that they can provide to families, parents, caregivers, and families in their communities. Next slide. And then this is just another example of some other fact cards that we provide to the coalitions that they can distribute within their communities as well. Next slide. These are some posters that we provide to coalitions, and the first two were designed by students. So we try to get student input as much as possible. We work with coalitions. A lot of them have their own youth action boards, and so we're able to work with them to get student input. We do positive community norms training with students and teach them what positive community norms are and how to create a campaign based on positive norming. So that's one in the middle is a positive norms poster that students developed. So positive norms being we look at the data, and instead of saying 10% of Oakland County high school students are using vape products, we emphasize that 90% are not. So we want to look at the positive side of everything. And then the final one is focused on parents about being an influence on their young people using cannabis products. Next slide. So now getting into some of the programs that we provide. So we work in collaboration with the Coalition Network to do school programs. We do them in school, outside of school, clubs, after school programs, stuff like that. And so we work with the coalitions, and then if a coalition doesn't have a good relationship or they're not working with their school, sometimes we're able to make those inroads with the school and then connect the coalition to the school. So our biggest programs are Renewed and Renewed Junior and Nourished Junior. So next slide, I'll just give you a little bit of information about each one. So Renewed is a program for 5th through 7th grade students, and it helps students learn how to deal with big and difficult feelings, teaches them some coping skills, how to navigate friendships. We talk about bullying, cyberbullying, how to use social media responsibly. So to date, I don't have my glasses on, so it's hard for me to read. We've reached approximately 5,000 students across Oakland County in 30 different schools. And we do summer programs as well. Renewed Junior. So after we had been implementing Renewed for a couple years, we heard from schools saying that they really wanted something for younger students, that young kids, especially after the pandemic, were displaying a lot of anxiety, depression as low as 2nd grade. So we took the Renewed program and tweaked it a little bit to be more relevant to younger students. So we offer Renewed Junior for 2nd through 4th grade students. And it touches on a lot of the same things. So how to navigate some big and difficult feelings. We don't get into the social media stuff with this one because, hopefully they're not really into that yet. But we really focus on friendships, what makes up a good friendship, how to be a good friend, and then how to identify a friendship that's not really a good friendship, that sort of thing. And so to date, we've reached over 2,500 students in 20 different schools and summer programs. Next slide. So Nourished Junior and Nourished. So we started Nourished Junior, a pilot program last year. And that's, again, for like 2nd through, 3rd through 5th, 6th grade students. We reached about 75 students with our pilot program. And then we got some feedback. We had a meeting with coalitions, and we gathered some data and learned a lot about the issues that older kids are having, particularly with body image. So we took the Nourished program and made some changes to be more applicable to high school students. Like 8th grade and higher, maybe 7th grade and higher, and have a whole section. It covers a lot of the same things that are in Nourished Junior, but then we have a whole section that deals with body image. So, oftentimes we think that body image is something that really only affects young girls, but young boys are really affected by body image and weightlifting and bodybuilding and cutting and, all the things, not cutting, but like bulking and cutting and working out and that sort of thing. So kind of helping them to understand proper nutrition, proper body image, not comparing yourself to other people, that sort of thing. Next one. And then Thrive Over 55, that is our older adult program. It's basically the WISE program, and we just put a different branding on it. With the permission of the evidence-based WISE program. So that reaches older adults across Oakland County. We work with older adults, senior centers, and go in and teach the Thrive Over 55 program. And then along with that, we also do some enrichment activities. So we partner with coalitions and community centers to go in and just provide some recreational activities for older adults as well. Next slide. We have our Community Wellness Expo. Again, that is a partnership. We have a wellness committee that is made up of several of our coalition leaders. We work together to create this large Community Wellness Expo that is at the Farmers Market in Royal Oak. It's coming up on September 10th, I believe is the date this year. There's a food truck rally, and it pulls together different wellness resources from across the county, and they'll have a booth there and just sharing their wellness practices, and it's a fun family event for the entire community. Mm-hmm.
So you mentioned that there's a food truck rally. What kind of food is?
You know, we don't handle pulling in the foods. The farmers market does that.
Oh.
So, I mean, I was there last year, and they had everything from sushi to they had lobster rolls. They had, you know, like just the full gamut of options.
Okay.
Yeah. Next slide. Next slide. Oh, there it is. Okay, so then Keep Them Safe, Keep Them Healthy is sort of our umbrella of all of our one-time prevention programs, as well as we have a two-class lesson that we do for 8th graders that talks about the different substances that young people tend to misuse, what their effects are, and then it goes into like better choices for dealing with your feelings and using substances, that sort of thing. But then we also go in and we have a one-time presentation for underage drinking, marijuana prevention, prescription drug prevention. We also have a fentanyl prevention presentation that focuses a lot on fentanyl and fake pills, and then vaping prevention. Vaping and marijuana prevention are by far our biggest request. And we know that one-time presentations are not the most effective prevention strategy, but it's a good way to get our foot in the door because then we try to offer wraparound services with some of our different programs that we're able to come back and implement. So these are very well received. The vaping presentation is constant. We get a lot of requests for the vaping presentation in schools. It's a big problem with young people. Next slide. And then Girls Empowered is a program. We collected data and found that substance use among young girls was higher than among young men. So we decided that we needed to create a program to address that. And so this is it's an after-school program. I believe it's 4 or 5 lessons that we go in and we just talk to girls about self-esteem and making good choices. They do like a community service project. And it's just sort of to kind of help young girls, feel good about themselves and learn how to make better choices. Especially, again, we often address like difficult feelings, like how to manage that and how to make better choices. And Catch My Breath is an evidence-based vaping prevention program that we're implementing in schools as well. So that's the high-level view of everything that we do. As always, we want to thank OCHN for its partnership, and because without the funding that we receive, we wouldn't be able to do what we do as the Alliance and also be able to support the coalitions and everything that they do at the local level. And that's it. Anybody have any questions? Yeah.
I was just wondering, when you said the community organizer gets $38,000, do you have, it just doesn't seem like, I mean, is that full-time or?
Typically, they hire a part-time person in the community, yeah.
Okay.
Yeah.
And
The majority of the funds is spent to pay their community organizer, although some coalitions will budget other money to pay for other things that they might need. So that's why we try to provide as many resources as we printed resources so that they can devote that money to pay a part-time community organizer. Yeah.
Are they part-time enough to get health care benefits?
No.
Okay.
No.
All right. So they'd have to work another job for that.
Yeah.
Okay. And then Girls Empowered, does that address bullying?
Yes,
Okay.
yes. Mm-hmm.
Perfect.
Yep.
Thank you.
Mm-hmm.
Other questions? All right, thank you very much for the presentation.
Thank you. Thank you for the opportunity. Appreciate it. Do I turn this off?
All right, we have updates from Committee of the Whole. We have a new representative, Yvette Woodruff, coming from the OCHN board. We'd like to welcome her. She has spent much of her career in the behavioral health area, serving on many boards related to mental health and substance use. Residing in Oakland County for the past 20 years, Mrs. Woodruff is a licensed professional counselor with a bachelor's degree from Oakland University and a master's in guidance and counseling from Wayne State. She brings a wealth of experience to the OCHN board that will guide her in understanding the needs of the community and priorities important to behavioral health supports and resources. So welcome, Yvette. Do you have an update from the Committee of the Whole?
Well, this is my first meeting. We
Sure.
had a Committee of the Whole meeting on last week. And of course, right now, what's on the table is the RFP, how that's going to affect programming in the future. And of course, we don't know the answer to that yet. That's about all I have at this point, but I will be prepared next time I come. Thank you.
Okay, thank you very much. Community outreach updates from Suzanne.
Good afternoon, everyone. Suzanne Weinert, Director of Communications and Community Outreach here at OCHN. Just wanted to give you some updates of happenings in the month of July and coming into August, also into September. So wanted to highlight a few things that have happened earlier this month. First of all, our Minority Mental Health Awareness Month event, we held that on July the 10th, and that was a very successful event. I'll be showing you some photos of it a little bit later in the slides. We had, well over 60 individuals that attended, some great presentations, learned a lot about cognitive wellness. We actually had someone from the Alliance who is a big part of the planning process for that event and did a lot of work with our students. We had a student panel for the event. You'll see an image of that as well, which was a really great interactive conversation with some of our students, and it's just very enlightening to see the youth that are coming forward today, because they really are shining and showing that they are very mature in the way that they represent themselves, be it with their phones, with social media, in the community. So it was very, very impressive. So I'll share a little bit about that at the end of my presentation. We also had a couple of events that we attended. One of them was a really big event, ViewFest. The Mental Health Walk and Celebration is actually a large event held at the Detroit Zoo just not last weekend, the weekend before. There were well over almost 3,000 people in attendance at the event. So it was a good opportunity for us to get information out about OCHN. I also wanted to make mention, we've talked a little bit about our free community substance use disorder workshops. We also held one of those. They're all virtual, and they're held in the evenings at 6:30, and we did hold one of those on July the 10th as well, and it was wellness for mental health professionals, and I'll highlight a couple others as well that are coming up in August. Also have some other trainings and other events that we are attending this month, and I'll go ahead and have you go to the next slide. Another thing that's happening this evening, and one of our very own Sherry is going to be at this event this evening in Southfield regarding the dangers of synthetic drugs, and it's a community forum that's being held in Southfield, and so we'll have our own Sherry that is going to be attending this evening for us. Also wanted to mention some other events that are coming up that we are a part of this month. The Brooklands Block Party, OCHN will be represented there and assisting that community. As you know, definitely a community in need and needing information about OCHN. also participating in the county's Health and Housing Fest that's coming up next month, as well as I'll talk a little bit about our event coming up, being hosted here, the Your Voice, Your Value event. I've got a slide for that with a flyer. I also wanted to mention some of our upcoming, the substance use disorder free community workshops. We have another one coming up next month, and it is about neuroscience, addiction, and recovery. And again, those are hosted only virtually. They're at 6:30 in the evening. The next one is going to be on August the 14th. And then for the remainder of the year, we have another one that's going to be coming up in October. That's on October the 9th. And again, it's going to be held at 6:30. And that one is about group therapeutic factors. All right, next slide, please. This is just a little rundown of the press releases that we put out this month. I've already talked a little bit about Minority Mental Health Awareness Month event that we held, as well as we have another one going out today about the ADA and Disability Pride Month. And then we have ongoing advertising efforts that are occurring in the community. This is just a highlight of some of the different things that we have going on the SUD side. We always have our billboards and our bus ads. We've had some mall ads in the past, as well as theater ads. In addition, we have our cable, Comcast cable, as well as some advertorials in Metro Parent. Next slide, please. A little recap of our Minority Mental Health event that I mentioned, just showcasing the student panel that our friend Justin from the Alliance was able to facilitate, and like I said, very rich discussion. And then we also host an ambassador program, which you'll see that's Amelia with one of our staff, Keeney, at the top. And the ambassador program is an opportunity for individuals that we serve to come and participate in our OCHN events. And they can host the table and they can represent OCHN and learn a little bit more about OCHN, but also be represented in the community. Next slide, please. As I mentioned, this is just a little highlight of some of the events that we have coming up. One that you're probably really interested in is the Recovery Celebration, but I did mention the Your Voice, Your Value conference that is coming up on August the 5th, and it is from 9:30 to 12:30. Lunch will be provided. You're obviously welcome to come. It's an opportunity for us to showcase the talents of the individuals that we serve. We're going to be highlighting our work groups, all of the various work groups that OCHN hosts, and we'll also be recognizing those individuals, our peer and achievement awards. So it's a really wonderful event. We hope you can join us. Obviously, our recovery celebration is coming up, and that's going to be on September the 9th. It's going to be hosted here. It's from 11 to 1:30, hosted here, not in this room, because we could not accommodate that many people in this room. It's going to be hosted in our parking lot, and we have our featured performer and author, local artist, Bryce III, is going to be joining us, and lots of great activities and events that are going on. So we're looking forward to having around 300 or 400 people in our parking lot for this great event.
And just to clarify, it's September 19th.
What did I misspeak? My apologies, September the 19th. Thank you so much. Just as a side note too, there is the state recovery celebration that is going to be on September the 12th. And that's all I have.
All right, I was just curious if there is some place online that people can see this, like the OCHN website, where they can click and sign up?
Yeah, we have this information on our website, on our calendar.
On your calendar,
Yes.
Great, thanks.
One last thing that I did want to mention is our proclamations. So September is a dual observance month with Recovery Month as well as Suicide Prevention Month. And each year we send out proclamations to recognize both Recovery Month and Suicide Prevention Month in September. So we did bring those proclamations forward to the OCHN board, and those were approved last night, in fact. And those will be sent out. We usually send those proclamations out to our local cities, villages, and townships, as well as our school boards and faith-based organizations, in the hopes that they will adopt those proclamations and bring those forward to the community and bring this important information forward to the community. That's all I have. Thank you.
Thank you. Any other questions? All right, moving on to prevention updates by Hillary.
All right. You can go ahead and move to the next slide, Kara. All right. So SINAR is one of those non-adjectives, which is fantastic. Adjectives. Sorry, my brain. I'm sorry. Acronym. Thank you. Sorry, I'm running on low sleep today. It is not an acronym, and it's actually a last name. So to explain what SINAR is, it came from legislation back in the early 90s. It was one of the legislators' last names, and the amendment was put in place to focus on decreasing the illegal sales of tobacco to underage individuals. So they put out legislation that the states needed to do different things to try to make sure that everyone is in compliance with that. So annually, we receive funding from SAMHSA, and it rolls through MDHHS, where we are going out and completing what are called SINAR checks, compliance checks. So they're going out to the local retailers who are selling tobacco and kind of doing underage kind of stings, if you will, right? They're going to see if they're complying with that. The thing that's nice about the SINAR checks is that before that happens, they're going out and doing education, because it's not meant to be a gotcha moment. It's meant to be an education, really providing the support to the community. And so they're going out prior to these compliance checks. They're giving education. They're providing all of the signage that needs to be out in terms of the age sheets and things like that, that says if you were born, before this year, things like those types of things. And again, just giving support to the retailers, because I think some of them, part of that is part of the concern. And so we are required to, as a state, to be above 80%, to be 80 or above percent in terms of our compliance, which means that 80% are not selling to underage individuals. So we're happy to report that in Oakland County, we were at 82.5% compliance, which is fantastic. There were 40 retailers that they had gone out to see, and so there are a lot of youth that are involved in really wanting to make a difference, and that it's all volunteer-based. They do get a small stipend, but it's not anything significant. So a lot of it is that they're really interested in going out there and really bettering their community. Underage individuals being under the age of 21, between 16 and 21, really wanting to ensure that they're not making those sales. So that's an exciting thing. It also does drive our allocations for funding. So in addition to it being a really great thing of reducing the illegal sales, it's also making sure that we're maintaining funding that aligns with that. So that's a little bit of an overview of SINAR. This is an annual project that occurs, and it is something that is state regulated and has been going on since the early 90s. Before I move into the quarterly data report, do I have any questions about SINAR? Nope.
Yvette?
My question was, the retailers that you provide the education to, is that the same retailers that you go back with the recheck with the students?
So the retailers that we provide education to is every retailer that resides in Oakland County,
Okay.
which is significant. Now, the retailers that we go out and do the compliance checks are actually given to us by MDHHS. So if you think like an audit sample, they pull a sample
Gotcha.
from all of the retailers. And so we have our liaison who works actually through the Alliance, and he is our tobacco liaison who handles actually all of those compliance checks and works with the students and things like that. He is checking that list, ensuring that all of the retailers are accurate, that, if there's been any changes, if any of the retailers who we would be unsuspecting would be selling tobacco, really, really boots on the ground in terms of making sure that that's accurate. So then when the state is pulling the sample, they are really kind of getting all-encompassing. So it then kind of goes through all of Oakland County.
Thank you.
You're welcome. Yes, Colleen?
All right, so I'm just curious, the students, they basically try, maybe they're underage or something, so basically they try to buy tobacco, and if the retailer sells to them, then they get back to you to sign her?
So they go out with our liaison from the Alliance. So they're with an adult. It is between the age of 16 to 20. There is no official sale made, so there's no law that's broken in this process. So it's just if they make an attempt and prior to money exchange, you'll know if they're willing to do it or not. So that's how they determine if it's a pass or fail, if they're moving forward with processing the sale. And it's all volunteer-based. So again, it's complete. There's the staff member that's with them. So they're supervising, ensuring that everyone's safe. There's no concerns regarding that, and no laws are broken because no official sale is occurring. It's like a mock, if you will.
Got it. And your information starts with FY25 in our packet?
I will be moving on to the data report following this, yes. Okay. So this would be right before, in your packet, this should be right before FY25.
It's actually not in the packet, but that's fine.
Okay. I apologize. Any other questions related to SINAR? Awesome. All right, so we'll move on to the slide that does say FY24, or 25. All right, so I'm going to give an overview of our Q3 data. You can go ahead and move forward, Kara. Okay, so this is, again, how many individuals were serviced during the quarter. So this is April to June of this calendar year. So those that received intensive outpatient were 43. Those who received non-intensive outpatient was 98. And those who received 24-hour withdrawal management was 169. Those who received MAT services, so medication-assisted treatment, were 68. Those who received long-term residential were 44. Those in short-term residential were 354, and those who received women's specialty services was 16. The next information is related to our sober support unit. So the numbers that you're seeing up there are those who were serviced through the sober support unit, and then also they're tracking how many are following up with treatment. So they are providing resources, linking them to services, getting them to treatment, things like that. So we want to see the correlation. So we do see there's a pretty significant amount of individuals that go through the sober support unit who do follow through with some form of formal treatment, whether that be residential, outpatient, getting linked into support groups, things like that. So we do see a really positive outcome with the resources provided from the sober support unit. So 324 individuals were serviced, 310 of them followed through with some type of formal resource.
And typically that's about 96% of individuals coming through the SSU follow through to the next stage of services.
All right, and then in terms of our health home admissions, and I do realize that there's a mistype in the naming. However, so the SUD health home admissions refers to our non-Medicaid individuals, and these are also individuals who have a diagnosis outside of opioid or stimulant use disorder. And so these are the individuals who we are servicing outside of the state's program of the health home, ensuring that all individuals who are interested in health home services are receiving them. So 2 individuals received during third quarter. And then our opioid health home is now actually named the SUD Health Home 2. And that is the same exact program, just the state renamed it during fiscal year 25. And there's 96 individuals during quarter 3. And then the last number, so these are the individuals who are underinsured. So again, individuals who maybe have a private insurance and have a high copay that they're unable to support to receive services. And so we want to ensure that insurance or being underinsured is not a barrier to services. And so there were 68 individuals that were serviced in some form of substance use treatment during quarter 3. And that is everything.
Questions?
Colleen has a question.
What's a health home as opposed to inpatient?
So a health home is not a formal home. It's more of a wraparound services. So, yep, they're receiving, they're addressing medical, they're addressing housing, they're addressing any type of comprehensive, if you would imagine, case management type services, if you think about it that way. So yeah, it's not a physical structure. I know the name is a little bit misleading.
We've complained several times to MDHHS and have said, it sounds as though this is a home or some place you go to receive a service. And essentially, though, the health home service, it's a care coordination service. So it's, if a person is at their SUD provider and they're talking about, I have a toothache from my youth, I need to see a dentist, I haven't seen a dentist in years, the health home service, it pays a coordination fee to the provider to assist the person in contacting their dentist to set up an appointment, or if they don't have a dentist, help them find a dentist. So it's really helping the person coordinate care for all types of behavior or physical health services they might need.
Thank you.
Thank you.
All right, legislative updates given by Francis Carley.
Hi, everyone. Good afternoon. So I have a few updates for us this month. Let me just find my page. So to start, OCHN, every 3 years, we complete a strategic plan, and that provides kind of the overview for our annual plan. And so we're currently in the process of doing both of those planning processes. And as part of the strategic plan, we have identified 4 kind of key priority areas for the next 3 years, 4 areas that will guide us and help us focus our work and build out the annual plan and objectives. So the 4 main priorities that we've identified so far, crisis continuum services, and so that includes providing crisis services, whether that's on the justice side or mental health side, building out a comprehensive system of care that includes direct services as well, and the provider network, and building out, helping to focus the overall kind of quality and comprehensive service array. And managed care operations, administrative operations, that is on the PIHP side. So that's really the managed care functions and bringing in items and services that have been delegated in the past and helping prepare us to really become a stronger service organization in the upcoming years. And then, of course, advocacy partnerships and outreach, and that really is our cornerstone for community service and the partnerships for services that we provide. So those are the 4 areas we're working on. We will be taking the strategic plan, the FY26 plan, which we're currently in the process of developing all of the goals, the objectives, and all of those details. And so we will be bringing that to the OCHN Board of Directors at the end of August, and for a vote and consideration in September. And as part of this process, it's very much a community process. We get feedback from people receiving services through the needs assessment, which I discussed, I believe, during the last OPB meeting, and the outcomes from that. And so that information really feeds into the planning and the decisions for setting the goals in the upcoming year. And so then next, I also wanted to discuss the advocacy for federal Medicaid and SUD funding. So as everyone I'm sure is aware, the federal government recently passed a bill for that includes significant cuts to Medicaid, to food assistance, and many other programs. One thing that we understand, so the House Fiscal Agency in Michigan, they released an analysis just in the past, I believe, week or so to really break down what these cuts could mean for Michigan. And everyone is still trying to really piece together and figure out what the cuts mean. But they're anticipating, I believe it was about $600 million. We would see that directly impacting the FY26 budget for the state. And so it's concerning. I'm still trying to piece through and really understand, but that analysis is available from the House Fiscal Agency for reference. And generally speaking, what we have been able to gather through some of the national advocacy organizations that going forward, Michigan may see, I believe it's beginning in 2028, cuts to Medicaid anywhere from $2 to $4 billion annually. And so that is, of course, of great concern. And the state will have to decide how the cuts will be made. Each state has its own Medicaid program. There are 50 different Medicaid programs in the country. So advocacy for parity is going to be very important in the upcoming years. As historically, when there have been significant Medicaid cuts, what typically happens is that behavioral health services are cut at a deeper level than physical health care, and anyone in this field and in this community public mental health substance use service area knows that it's very difficult to have good physical health outcomes if the behavioral health outcomes are not considered and taken care of. So advocacy for parity is going to be very important. Another thing with the SUD funding is that if the state does go in a direction where individuals who are receiving Healthy Michigan Medicaid services, that insurance, if they are cut from service, what will happen is that they will be receiving PA2 funding for health care, which could impact the recovery and prevention dollars that are available through the county. And Megan,
Block grant funding.
Block grant. Oh, it's block grant.
Could
Okay,
be
sorry.
PA2, but it's most likely going to be our block grant fund.
The block grant. Okay,
Yep.
Thanks for the correction. But yes, as Megan has pointed out to me and explained to me, which I'm sure she can provide more detail, that there will be kind of that domino effect with the funding. So even if the substance use block grant is not cut, then there will still be those impacts because of Medicaid. So we will continue advocacy on at the state level, the local level, really fighting for that parity, and that is top of mind as we move forward. That's something that we've been including in all of our advocacy letter templates, the idea that we need to have that system stability ongoing. And so that brings us to the next item that I wanted to cover today is the status of the state procurement and RFP, which Ms. Woodruff mentioned from the board discussion previously, and it's something that OCHN is very much concerned about and that we've been really focused on with our advocacy. So in terms of the state RFP, we still don't have very much detail about what it will entail. We understand that the advocates and on the Medicaid health plan side are very much
informing people that, this is something that the community wants, that the community is really advocating for. But it's still our understanding from the very limited 1.5 kind of page summary overview of what to expect, that this is the same document that was released in May. We haven't really received any additional information about this. So the two kind of key takeaways from that is that it's opening the door to privatization, and that also the proposal is to merge Oakland County Public Behavioral Health Services with Wayne and Macomb counties. So that is still on the table. The state would like to go from 10 to 3 PIHPs, and so that is still very much in play. And we don't really have any more detail than what we were initially provided in May, even though we have heard rumors and we have seen in the state procurement system that they're anticipating releasing the RFP in September, but that is, I guess, subject to change. We don't have an exact date and have also heard that it could be in July as well. So to that end, we have been really advocating at the local level, and thanks to the county commissioners, we received a resolution opposing the RFP July 17th. So that is, I believe, pending signature and publication. OCHN's Board of Directors also passed a similar resolution to that effect, and we've received several letters of support, including from the sheriff, the Association of Police Chiefs, which I believe that's 43 police departments represented there. We've also received letters from the 52nd District Court opposing the RFP, and Commissioner Woodward, and signed a letter with County Executive Coulter, also supporting the system stability and requesting the governor to hold off on this RFP, and especially in the face of the federal cuts. So that brings me to the resolution. Yes, that, as I mentioned, the commissioners and also OCHN's board passed resolutions to that effect. And then our CEO, Dana Lazenby, has been conducting significant local state outreach. We're in regular communication with our senators, our representatives, our local representatives, and trying to generate that local support and make our advocacy strong, our advocacy points and concerns known. And we are also working with our persons receiving services who are on our work groups, and connecting with some of the providers as well to try to generate that advocacy, and including the SUD directors. So this is, something very active, and something that is subject to change. We're still trying to understand what the impacts would be, the intention, and we will be providing updates as we receive them. Additionally, for awareness, we are pulling together a town hall which is scheduled for August 18th. And so that will be from 4:30 to 6 p.m. So please look for that invitation.
Thank you.
Francis, is it going to be here, the town hall meeting?
Yes.
Any other questions?
What's the advantage of condensing the 10 PIHPs into 3?
Well, that would be, I believe, a question for the state. It's, we hear some of the talking points that I've heard and that we understand is that the thought that it would be reducing administrative overhead. However, based on some of the conversations that I've had trying to piece together and really understand what the ultimate plan is, it seems to me that it would create more administrative layers, that the idea would be a private nonprofit entity with a potential PIHP partner and kind of additional sub kind of categories and agencies within that. So, that's a couple of steps removed from our OCHN's direct relationship with the state. So I don't really, it's difficult at this point to really piece together and understand what the ultimate intention is.
You did mention something about privatizing this, or did I hear you wrong?
That's correct. From the one pager, 1.5 pager that the state has released, there's very limited information. However, the indication, the kind of requirement that is outlined and stated is that an eligible bidder would have to be a nonprofit organization. Previously, 2 weeks prior to saying generally nonprofit with kind of an asterisk definition subject to change, the state had released something saying that it was a 501c3 requirement nonprofit. We know that several of the private health plans are 501c3s or nonprofit organizations under the state law otherwise. So that is the kind of private understanding how it ties into privatization. Additionally, what we've seen, also very, very limited information about the state's plan for kind of a system overhaul, is that there would be more, the idea, it appears, is that more services would be bid out to the private entities rather than the CMHSPs. And the SUD service providers, it's unclear how that would tie in with also kind of this move to the CCBHC becoming a direct provider with the state. So the CCBHCs, the state is planning to move them, many of which are private, and outside the CMHSP kind of direct contracts system. They will be contracting directly with this, or maybe not contracting per se, but they would be paid directly through the state, bypassing the CMHSP and PIHP system. So that's something that's in progress currently, and the state plans to enroll at least that direct CCBHC payment beginning, the goal is October 1st, so just a couple of months from now.
All right, thank you.
Thank you.
And there is in our packet advocacy letter template for anyone who's interested in sending letters asking for support. All right, Director's Report, Megan.
Yes, hello, good afternoon. So to go off of some of what Frances was talking about, she was referenced in regards to Medicaid, what has come down from the federal government with the bill and the new changes they're making with it. Something that we want to make sure that the board is aware of and everyone's aware of as well is when it comes to our block grant dollars, we are facing possible cuts to our block grant dollars as well. So as you know, I think it was either last time or the time before I had done a larger SUD presentation. I had gone more in depth talking about all of our different funding sources. We've received block grant, PA2, Medicaid, HMP dollars. So our block grant dollars, these are the dollars that we receive for individuals with no insurance who are underinsured, and it also covers all of our prevention services because our prevention services are not a Medicaid-covered service. So, for example, all of the work that the Alliance does with the exception of the Save a Life boxes, because that falls under our state opioid response grant, but those coalitions, that is all funded from our block grant dollars. So what is currently going on at the federal government level is currently they are working on the fiscal year 26 budget. Currently, what the current President Trump has proposed in his budget is the dissolving of 3 federal agencies, the Centers for Disease Control, SAMHSA, Substance Abuse and Mental Health Service Administration, and the Office of National Drug Control Policy. And so all of those 3 agencies would become one agency called the Administration for a Healthy America. So with that, those 3 currently independent agencies that are operating, they would be put under one, and the budgets that they are looking at, there is not a significant concrete number, but with what is being projected right now is around a $1 billion decrease in funding for the 3 of those. They would also then take our current SUD block grant, the mental health, they have a mental health block grant as well as our state opioid response grant funds. They would take all 3 of those funding pots and create a brand new grant funding pot. And then that new grant funding pot is the money that then gets allocated to the states, and that money is then pushed down to the organizations providing the services. So currently our block grant dollars, 82% of the block grant dollars that we receive from MDHHS is federal money that comes direct from SAMHSA. So it's only about 18% is state money, 82% is federal money. So essentially, when you look at all these different pieces that are going on, we kind of have a lot going on right now. With the possible cuts that occur with Medicaid, what that means is we could see an increase in our block grant funds because if somebody loses their Medicaid or HMP, they have no insurance and they can't afford to go through the marketplace to buy something, then they would come to us with no insurance, and that means we're going to see an increase in our block grant dollars. Well, if we see an increase in our block grant dollars, then in order to provide services, other initiatives that we are doing now become at risk. So, for example, our Save a Life stations, which we know has led to a 37.6% decrease in overdose deaths in our county in the past year, we come to a place of deciding, can we continue to fund those or can't we? The Sober Support Unit, something that we use PA2 for to fund. We have to sit back and say, can we continue to fund this? So it matters in the big picture. Some people might think, well, whether it's the general public, I don't have Medicaid, my family doesn't, it doesn't affect me. But it affects the bigger picture of all the other services that we're able to provide in the community as well that aren't funded by Medicaid. They're funded under the block grant dollars or under the PA2 dollars. So what we could be facing, and we don't know with certainty yet, the federal government needs to pass their budget, then it's possible there could be lawsuits that tie things up for a while. So how long does it take for everything to trickle down? We will see. So far for this fiscal year 26, we've received our allocations. They're in line with what we expected. I know through my conversations with our contract manager at MDHHS, she's very concerned that we could get 2 months into the fiscal year, 4 months into the fiscal year, 6 months into the fiscal year, and we're told, well, yes, your block grant budget was $6 million. It's now $2.5 million. And it's very possible that that might happen. If it does, we have ideas. We have, of what things could look like. One of the things, I've been talking to our provider network about what this looks like, right? I need to make sure our providers are well aware this is what could happen and this is what could go on. And I tell them the hard part is I can't give you an exact answer yet. If we start taking these types of cuts, I can't tell you right this minute exactly what it means. Because then the conversations I have with our finance department is I need an exact number, and then we can start really going through line for line and saying, what's a contract requirement for the services we're providing? What is it we are required by MDHHS to provide, and what is it that we like to provide? For example, peer recovery coach services. I think that's one of the cornerstones, one of the best services we're able to provide. We provide it across all our levels of care. We have our peers embedded in outpatient, withdrawal management, residential. But that is a service that is not a contractually required service. So if we start taking cuts via Medicaid or block grant, we have to step back and say, can we continue to provide this service? Recovery housing services. Not a contractually required service with the state. So again, another area we would have to look at. All of which things are dependent on what are the actual numbers that come down, right? We do sit on a healthy PA2 reserve balance, but we also have to be mindful of what is it we can do and maintain, right? And so just that is what the landscape is looking like right now, and we will see what actually happens and what plans we actually have to start putting forth should we start to see these things. We could go through the entire fiscal year and not see a cut. That's possible. Fingers crossed. That's possible as well. But wanted to make sure that the board's aware these are the challenges we could be facing, hard decisions we might have to make, and a lot of them break my heart, and I'll be the first one always behind the scenes when leadership and I are talking. I'm like, we're not doing X, Y, Z. I won't cut it. So it's they're hard decisions we'll have to make should the time come, but we're just mindfully watching it and trying to be mindful of our dollars right now, be mindful of what we're spending and what we're spending it on, and looking at our services currently and saying what is meeting our expectations and what should we say we need to discontinue doing this right now for this moment to conserve some funds. Any questions?
All right, thank you. Quarterly financial update, Ken Melvin.
Good afternoon, everybody. I see Richard Carpenter, so I'll give a quick intro to myself and Richard as well. My name is Ken Melvin. As I'm sure the group knows, OCHN has contracted the Chief Financial Officer function to Raymond. So I work for Raymond. I work with Richard in the CFO office to provide those services. I've been here about a month or so at this point. Just a little background on me. I'm a principal at Raymond. I work out of our Troy office. I've been consulting in the CMH space for over 5 years now at this point. So almost exactly when the pandemic hit is when I started doing this work. So Richard, I see you're online. I don't know if you want to chime in with anything right now.
Good afternoon. Are you able to hear me in the room okay?
Yes.
Excellent. So just want to say that I'm excited to be here at OCHN. Got a chance to work with Megan already and excited about the opportunities we have and look forward to working with her and with the Oversight Policy Board on a going forward basis.
Thanks, Richard. So we're going to kind of tackle these, both the quarterly financial update and the 2026 budget presentation are on the same slides as far as I know it, so we'll kind of go through those things together. I'll do a lot of the presentation related to that with Richard's input as necessary, and certainly Megan as she wants to add any commentary to that. I'll also say that we have our first slide up here. The presentation might be a little bit different from the way that's been presented in the past, particularly the fiscal 25 to fiscal 26 budget columns. You'll notice some variation between those two that's fairly significant, especially on the expenditure slide, which is the next one. And I can cover that in more detail when we get to that slide, but I'm saying this now because if there is feedback from this group about how they want to see information presented, if this works. Like I said, we've just recently started doing this work, so the 26 budget column is how I would like to present the information and how I'm going to aggregate that going forward. So certainly open to any feedback that the group has as we go through this information or after the fact, please let me know. So I'll switch gears over to what we have on the slides at this point. So slide 1 is our fiscal 25 Q3 projection, in addition to our budget projection. So one of the things that you'll notice on this slide in particular is Medicaid and Healthy Michigan. Those revenues have increased when we look at 25 compared to 26. The reason being for that is that there was retroactive revenue adjustments that the state has pushed through, but those haven't actually been realized in actuals at this point. We expect that retroactive activity to occur over the next couple months. So as we look at 26, we anticipate having that revenue in hand, but through Q3 of 2025, we haven't fully realized that yet. So that's going to be a key difference there. You'll see PA2, that's also one, some timing differences there, but the $5.5 million in the 26 budget is what we expect to receive at least in 2026. We have reached out to the Treasury Department at the state. They have not posted the 2026 anticipated, at least through last week when this presentation was done. I have not seen anything new. So that number could go up or down based on what we actually see from the state, but as our best guess at this time as it pertains to PA2. Additionally, here on the revenue slide, you'll see the ARPA grants for prevention and treatment. Those, as Megan mentioned, that funding has been eliminated, so hence the reason that it's 0 in the 2026 column. And then we did have a slight increase in some county-funded programs that are down there at the bottom. Any questions on the revenue slide before I move on to expenditures? Okay. We go to the next slide, please. So the expenditure slide, as Megan said, we have projected that Black Grant, at least at this time, our allocations are very similar through this period in time. So our expenditures here, when we look at the 25 budget, we're expecting, oh, sorry, I'm looking at the wrong slide myself. We're expecting an increase in expenditures on our Medicaid and our Healthy Michigan populations. Medicaid's pretty static comparatively, but expecting Medicaid and Healthy Michigan to go up. You can see here, one of the things on the expenditure slide, when you look at the fiscal 25 projected, this is one of those presentation changes, where previously any PA2 overages, and what I mean by overages is if we spend more on Black Grant than we've actually had allocated, which is not uncommon, but those dollars would be funded out of PA2. Similarly, SOAR or any of our other SUD programs for the most part. So those overages were in the 25 column included in those lines, such as Black Grant. You can see our 26 budget, Black Grants actually we're predicting less expenditures. Now that's not because we actually think there's going to be less expenditures, it's because of the way that this is being presented here. So if you halfway down the page or so, we have a PA2 line where we expect and request that we get approval from this group ultimately, is about $6.8 million in PA2. So that represents a change in presentation from the 25 to 26 column. So the idea being that we pull PA2 out of the lines above it, have it kind of separately identified, and I think that improves reporting and transparency to this group as we look at our PA2 spend. So that it is a presentation change, but I wanted to acknowledge that here. When you look at those two lines, there's quite a difference. So while we're on the subject of PA2, we can talk about what we have going on a little bit there. The ask this year is more than it was in the prior year. Megan touched on some of those key drivers. We have built an assumption into the PA2 dollar that we are going to have a decrease in block grant funds in fiscal 26. I think that's a conservative way to budget this. We've also budgeted it with some of our SOAR funding that Megan mentioned and not cutting that programming. So that's in our PA2 dollars. Additionally, we continue to see the effects still to the pandemic and the unwinding of that and Medicaid eligibility. So as Medicaid eligibility is impacted, those people then become block grant recipients. So anticipating some increase as a result of that as well.
And then to just touch on specifically what we use the PA2 on in terms of programming, obviously the sober support unit has always been fully funded by our PA2 dollars. Underinsured or people with third-party insurance, typically we try to use block grant dollars first, but then there's times because of payer order we cannot use block grant, and we use PA2 dollars to fund those individuals who can't afford their treatment services. So it's used for those individuals. Let me see. We moved to the My Strength. We use it for different events that occur. We use it to fund our recovery celebration, and then also our prevention and treatment services in general. One of the reasons why the board has historically approved the use of PA2 dollars is so that way we've never had to go to a wait list in the community, and we've been able to offer full services to individuals regardless of if they have Medicaid or block grant. And so again, all of that remains the same. I think in terms of what we have truly budgeted for fiscal year 26, I would say the difference between 25 and 26 for actual programs, the SSU, things like that, we probably increased it by about $200,000. That $2 million plus dollars, like Ken said, we're really making sure we have money set there and approved. Should we take any Medicaid cuts? Should we take any of the block grant cuts? We get halfway through the fiscal year and the state tells us, sorry, you had $6 million, you now have $3 million. And we can move as quickly as possible to start to pull things and change things, but we still have contract requirements where we have to give notice to providers or notice for contracts for things we're funding. We can't just stop it immediately. So it's going to take us a minute to shift and change, and so that's why we have that ask that's larger than what was asked for last year. The reason why they would say we had $6 million and now have $3 million is because of the cuts that we expect to be coming from SAMHSA. So the block grant money we receive, it comes from SAMHSA, which is at the federal level. And we expect for SAMHSA to receive federal funding cuts based on the budget for fiscal year 26, which is then going to change the budget that gets pushed down to the states, which then changes how much the states push down to us. And we don't know those yet. Gosh, it's not uncommon. It happens that you'll be midway through a fiscal year and the state says your block grant, allocation amount changed. It's not uncommon. We've been very fortunate the last few years. We really haven't seen it happen, but I think it was a little more pre-pandemic. It's happened a time or two.
And I'll just highlight too, for instance, with some of the ARPA programs, that was a fairly sudden occurrence. So that is not out of the realm of possibility either. So we've tried to build that cushion into our budget. I know there's a lot on the expense side. Any questions about what's been presented on this slide? Okay. Next slide is our net position slide. This is essentially revenue less expenditures. You can see probably the key thing to highlight here is in the fiscal 25 column, we're looking at Medicaid, or at least a Healthy Michigan deficit, and expect that to continue into the end of the fiscal year. So that's good news with some of that retroactivity. The prevention overspend there and the block grant overspend, I would say kind of net with the PA2 dollars that we have in surplus there. So going into 26 budget, the last column there, you can kind of see where we expect a surplus in both Medicaid and Healthy Michigan, and that PA2 overage there that we have is an expected spend out of our fund balance there. Going to the next slide. I don't think there's much I want to highlight here. This is just an aggregation of the previous slides, but the next slide after that, our PA2 slide, is one that I want to cover and just highlight that fiscal 24, we just wrapped our audit related to fiscal 24. We were able to put money into fund balance for PA2, expected to do the same in the fiscal 25 with projected numbers being used right now for that. So at the end of 25, we would be looking at sitting around 13.7 million at the end of this fiscal year. And like I said, on the expense or the net position slide, fiscal 26, we would have, roughly a $1.3 million spend out of PA2 fund balance to keep programming essentially static and not cut services at this time. So that is what we expect to happen with our PA2 funds through 26. Hopefully things don't unfold in a negative fashion and our results are much better than this, and we'll certainly report back as to how we're doing throughout the year in our reporting, but wanted to be conservative with those estimates. That is the end.
Mike. Thank you, Madam Chair. I do have a couple questions.
Sure.
If you go back to the previous slide, just the budget comparisons, the numbers are slightly different from the projected 25 for both revenue and expenditures than the previous three slides. They're not, we're talking $50,000-ish, but I don't know if that was because something was missing somewhere else or a round error or something.
I will look into, so yeah, the ending deficit essentially in 25, not comparing to the...
Correct.
Yep. I'll have to look into that, and
Okay.
I'll respond back with what happened there.
All right, thank you. And my other question, and maybe, Megan, you might have to help answer this. Speaking of PA2 dollars, we're looking to spend $6.8 million in 26, right? But if you look at the history, we've never come close to spending that. I know we're probably hedging our bets slightly based on what's coming or what we think is coming from the feds. Is that 100% the reason why we're doing that? Because it's like a $3 million, $4 million shift.
That's 100% the reason why the ask is 6.8 million. The intent is if we don't take block grant cuts, if we don't take Medicaid cuts, if we get through this year and we don't take those cuts, we wouldn't be spending 6.8 million, and then anything that is not spent would be going right back into our reserve. So we're asking on the high side to account for the cuts that we believe could come. If they don't come, we're not going to spend 6.8 million. I'm correct in saying that, right, Ken? I don't want to be misspeaking.
I think that's the majority of it, and if I'm just to elaborate on that, if I'm understanding the question, if you look at the expenditure slide, and particularly if you look at the historicals there, our max through 2025 is like $1.1 million, right? So that a piece of that difference is pulling down those overages that I mentioned.
Correct.
Out of block grant, Medicaid, pick one of the funding sources above, and grouping it in that PA2 line. So the real ask and change, I would say, in true dollars from 25 to 26 is that $1.5 million or so that we've baked in for contingencies.
Okay, so if you go back to the PA2 slide.
Yep.
the previous years, if I go 21, 22, 23, 24, I would expect that those expenses those numbers don't have what you're looking to do in 26. They haven't been rolled down, right?
Correct. So if you look at,
They would be lower than what is really there, because they're still in the lines up above.
so on this slide, this is probably a better representation of it, that 4 million, almost 4 million, the 25 column,
Yep.
that spend, that would be kind of our static spend with the 1.5 million and some of those other programming things bringing us up to the 6.8.
Okay. But
Yeah.
if I went like back to 24, 23, that wasn't done in those numbers at all, sorry.
Correct.
Okay, that's what I thought. Okay, thank you.
Yep.
Any other questions? All right, Megan, with the fiscal year 26 budget, including PA2 request. Didn't we just do that?
Yep, those were the pieces I added in
Okay.
on what we're spending the funds for.
Okay. All right, any other questions on the PA2 budget for fiscal year 26 before we take a vote to approve?
No, I'll make a motion to approve the fiscal year 26 PA2 budget. As presented.
I'll try a unison vote first, and if we need to, we'll do a roll call vote. All those in favor?
Aye.
Those opposed? All right, motion passes.
Thank you.
Old business. So we have been provided changes to the OPB bylaws for the past few meetings. It's been tabled. So hopefully everyone had a chance to review it by now. Were there any questions on the proposed changes to the bylaws? All right, could I get a motion to approve the bylaws as revised in our packet?
I'll move to approve.
Second? All those in favor?
Aye.
Those opposed? Motion passes. All right, the OPB training plan. Tricia.
All right, good afternoon. Tricia Zizumbo, Chief Operating Officer of OCHN. We've talked the last few meetings about the training plan for the OPB that will mirror what we do for our large OCHN Board of Directors. So you should have, I'm going to share my screen here, a copy of some instructions. We went over Docebo, which is our learning management system, at our last meeting, and we took a look at that. So I kind of wanted to do a review for you, but you have a handout, I assume, in front of you that will have your password, your email, and how to log into the system. So I wanted to, again, brief you on what we had spoke about before on the different trainings that were going to be offered. There are two that are going through final approval right now that we will add to the learning plan. And this will cover a overview of OCHN, an overview of the SUD team, a Finance 101 training to give you a little bit more in-depth on finances, PA2 funding, all of the different ways that SUD is funded. It will also cover board member responsibilities. So it will clearly look at what board members are responsible for. It will have your bylaws in there. So the training that's in there right now were your current bylaws. And so any changes, we will make those changes, as well as a review of the Open Meetings Act, HIPAA and 42 CFR, as well as conflict of interest. We also have corporate compliance and some diversity, inclusion, and sensitivity training, which is, again, all done by our large board as well, and is really reflective of the individuals that we serve. So this right here is, and I blocked out for the camera, the passwords and the branch code, which you all have individually, are your Docebo login instructions. So there's the website there, how you log in, there's a link, and we'll email this out as well. There's a link to a video tour, which you can also get within the system, and it will take you step by step on how to access the system. So once you log in, this is the landing page that you will see. Over here, you should see your name, your email, and on the final page of your handout is a list of all of your emails, so you know exactly which email you used for this. The only person that you'll be prompted to change a password, you have a very generic password right now. The only person that will not get that is Yvette, because you're already logged in, and anything that you've already done, Yvette, it won't make you do it again, just so you know. So you will see this. This is where you can take a tour, but I've also linked that for you in the handout as well. And then you would click New Board Member, because this is a new thing that we are all starting. It's going to make me re-sign in. Let's see. Pressure's on if I remember the password. All right. So you will not see this. This is my test account for all of our board and all of our stuff, so this is not what you will see. But I want you to take a look right down here. You will see something that says e-learning, and you will see something that says learning plan. So learning plan is the book, and e-learning are the chapters within that book. You will only see, with the exception of Yvette, your Oversight Policy Board learning plan. And you will click in that, and then you will see the different trainings, the e-learning trainings that are inside here. And so all of these can be taken at your leisure. They are not hard. I would not tell you that this corporate compliance takes an hour and 30 minutes. Each will take you maybe 20 minutes or so. And we wanted to get your feedback on taking a few of these and seeing how they go. You can see I've gone in and I've taken some and some that I haven't, but you would click play, and I'm going to go through one training, and this will pop up in your browser for you to start learning. And this is going to walk you through an overview of the SUD team. So everything is in here where you can see what the team does, what they oversee. You can meet the team. They have so graciously given me their wonderful, beautiful pictures so that you can meet each person on the team and what it is that they do and their role. And so you will continue to go through this training to give you that. And again, that's going to follow all of these trainings right here so that you would be able to see all of that in there. So I'm going to go back to the home page, and I'm going to pause for any questions.
Thank you. Hopefully simple question. How do I get to this link that's in my packet?
We're going to email that out to you
Thank
as
you.
well. So you
And then, thank you. And then my second question, with all the training, do we get regular emails if we have not taken
Yes.
it to make sure that
Well, yes.
we
So
remember to take it?
we will send you emails. Once you have taken it the first time, you will get emails at the 90, 60, 30, and 7-day mark of when their trainings are due again.
Okay.
And so those will be reminders. And so I am not too much of a stickler on the trainings this time. We wanted to give it to you, give you this next quarter to take a couple. Let's get your feedback next time. If there's any changes that I need to go into the system and make, we can make that together. I still have a couple to add in there that we are finalizing. But this is something new and something that we want to be collaborative on for that. So otherwise, we will make sure we send reminders to Megan and to Kelly to send out to board members to remind of them to do their trainings.
Thank you.
There. Make it as simple as possible, hopefully.
All right, and just to clarify, we have until the next board meeting to finish?
I wouldn't even say you have to finish. I would
Okay.
like the board to get in and maybe take 1 or 2 trainings, see how it goes. Let's bring feedback, back to the next meeting. If there's any tweaks that we need to make, we can make. And by that time, I'll have the additional Finance 101 and the OCHN overview in there as well, because we're finalizing that for our larger board as well. And being able to kind of get your feedback. And then we can set a date together on when we would like to have those trainings done. And then
Okay,
from
perfect.
that, it's a rolling date, meaning if you finish a training today and it's due every year, it'll be due today the following year. So whenever you take them, it's a rolling. And we have set them, I believe, for 2 years because the board seats for OPB are every 2 years. So, and I will double check that. Yeah.
All right, any other questions? All right, thank you very much.
Thank you.
Looking forward to the training. We do have 1 vacant board position, so please, there's a description in the bylaws of what people we are looking for, so please spread the word, direct them to the OCHN website to apply. New business, could I get a motion to approve the meeting minutes from April 23rd, 25?
So moved.
Second? All those in favor?
Aye.
All those opposed? All right, motion passes. OPB member issues or announcements. Does anyone have anything they'd like to say? All right, we'll open the floor again to the public. If anyone from the public had comments? All right, could I get a motion to adjourn? All right, everyone in favor? All right, so not only did we have a full agenda, I didn't have to table anything, and we are done half an hour early. So thank you very much.